Hey, future RN, coronary circulation is one of the most important topics for understanding myocardial infarction questions on the NCLEX. Today, we're going to cover the coronary arteries, what parts of the heart they supply, and how blockages cause specific types of MI. Welcome to ClearPath NCLEX. By the end of this, you are going to feel so much more confident about this topic.
So first off, why is it called coronary circulation? Well, it actually comes from the Latin word for crown, because these arteries sit right on top of the heart muscle, almost like it's wearing a little crown. And you might be thinking, wait, the heart is full of blood. Why does it need its own arteries? Great question. The heart muscle itself, the myocardium, is actually way too thick for oxygen to just soak in from the blood passing through the chambers. It needs its own dedicated high-pressure plumbing system to get the oxygen it needs to keep pumping. And that's exactly what these coronary arteries do.
All right, so here's our game plan for today. We're going to start with the big picture, then we'll dive into the right coronary artery, and after that, the left coronary arteries. Then, the most important part, we'll connect it all directly to the NCLEX and wrap up with a final cheat sheet you can screenshot for your notes. Let's do this.
Okay, if you remember one thing, let it be this. The coronary arteries are the personal fuel line for the heart muscle. They deliver that precious, oxygen-rich blood. So a blockage in any one of these arteries is a huge problem. It literally starves a part of the heart of oxygen. This is what leads to a myocardial infarction, a heart attack. And you better believe the NCLEX loves to ask which artery is blocked based on the type of MI a patient is having. This right here is the chain of events you absolutely need to know. It's a domino effect. First, you got a blockage, usually a blood clot. That blockage cuts down blood flow, which causes ischemia. Ischemia is just a fancy word for tissue that's screaming for oxygen. Now, if that ischemia isn't fixed and fast, the heart muscle tissue begins to die. And that, my friends, is infarction. So remember, blockage leads to ischemia, which leads to infarction. Super simple, but so critical.
All right, let's dive into our first major player, the right coronary artery, or as you'll see it, the RCA. A really good way to think about the RCA is as the artery that controls the heart's rhythm. And you're about to see exactly why that is. So the RCA has a really important job. It feeds the right atrium and the right ventricle, of course, but here's the really high-yield info for your exam. See these last points? It supplies the inferior wall, that's the bottom wall, of the left ventricle. And what's absolutely crucial is that it also feeds the heart's electrical system, the SA node, which is the heart's natural pacemaker in over half of all people, and the AV node in almost everyone. So let's connect the dots. If you get a blockage in the RCA, what happens? Well, it starves the inferior wall of blood, causing an inferior wall MI. But because the RCA also feeds the SA and AV nodes, our electrical system, you're very likely to see rhythm problems. We're talking slow heart rates, which is bradycardia, and AV blocks. For the NCLEX, if you see the words inferior MI, your brain should immediately go, okay, that's an RCA blockage and I need to watch out for bradycardia. Okay, now let's hop over to the left side of the heart. This whole system starts with one short but super important artery called the left main coronary artery. Think of it like a main highway that almost immediately splits off into two other major roads. And both of those roads supply the really powerful left ventricle. And those two major branches are the left anterior descending artery, which pretty much everyone just calls the LAD, and the circumflex artery, or CX for short. We're going to look at each of these one by one because they feed different areas and, you guessed it, they cause different types of heart attacks. Before we even get into the specifics, you need to know this nickname. The LAD is famously and unfortunately known as the Widowmaker. And this isn't just for dramatic effect. A major blockage right here in this artery is incredibly dangerous and, sadly, often fatal. That name alone tells you just how critical this artery is. And here is exactly why it's so critical. The LAD runs right down the front of the heart, and it supplies the huge anterior, or front wall of the left ventricle. This is the main pump. This is the chamber that sends oxygen-rich blood out to your entire body. It also feeds the septum, that's the wall between the ventricles, and the very tip, or apex of the heart. It's basically feeding the whole powerhouse. So it makes sense, right? If the LAD gets blocked, you get an anterior wall MI. And because this MI affects the body's main pump, it can lead to catastrophic heart failure really quickly. So when you get an NCLEX question asking about the most dangerous type of MI or the one with the highest mortality, the answer is an anterior wall MI caused by an LAD blockage. Now for the LAD's partner, the circumflex artery. The name kind of gives it away here. Think circumference. This artery wraps around the side of the heart. Its main job is to supply blood to the lateral or side wall of the left ventricle. And for some people, it actually wraps far enough around to supply the posterior or back wall too. So this one's a really direct connection. If your circumflex artery gets blocked, you're going to see a lateral wall MI or sometimes a posterior wall MI. It's a super straightforward link. The circumflex feeds the side and the back, so a blockage there hurts the side and the back. Easy enough, right? Okay, I know that was a lot of anatomy, so let's take a breath and consolidate all of this into exactly what you need to know for your exam. This is where we make it simple, clear, and super easy to remember when you're sitting there in that testing center. This slide right here is your golden ticket. It's got everything in one place, so seriously, pause and screenshot this for your notes. Let's walk through it nice and slow. First up, the RCA. It supplies the inferior wall and the nodes. That means an inferior MI, and you're watching for bradycardia. Got it? Next, the LAD. It supplies the anterior wall, that's your widowmaker, the dangerous anterior MI. And finally, the circumflex, or CX. It supplies the lateral and posterior walls, giving you a lateral or posterior MI. That is the core of what you need to know. All right, let's do a quick practice drill. Ready? First question. Which artery is most likely blocked in a patient who is presenting with an anterior wall MI? I'll give you a few seconds to think. And the answer is the LAD, the left anterior descending artery. Remember, anterior wall MI always equals LAD. Okay, next one. Your patient has a confirmed inferior wall MI. What specific rhythm change should you anticipate and be watching for? Take a moment. You should be anticipating bradycardia or AV blocks. And why? Because the RCA supplies the inferior wall, and it also supplies those crucial SA and AV nodes. Okay, last one for our drill. A blockage in the right coronary artery, the RCA, would most likely cause a heart attack in which wall of the heart? Think about it. The answer is the inferior wall. RCA and inferior MI are a pair that you have got to know cold. We are in the final stretch. I'm going to put up one last slide that boils everything we've talked about down to the absolute essentials. Think of this as your ultimate last-minute review tool for coronary circulation. Here it is, the 3 simple lines that are going to get you through these questions on the NCLEX. Let's say them together. 1. RCA leads to an inferior MI with possible bradycardia. 2. LAD leads to an anterior MI, the widowmaker. And 3. Circumflex leads to a lateral or posterior MI. If you can write these 3 lines from memory, I promise you will master these questions. You've totally got this. So remember this simple flow. Know the artery, and that will tell you which wall is affected, which then tells you what signs to look for. Thanks so much for watching ClearPath NCLEX. If this video helped things click for you, go ahead and like and subscribe for more high-yield content. And definitely hit that bell so you never miss the next game-changing NCLEX tip. Drop a comment below. Which artery do you always remember first? I read every single one. You're doing amazing. Keep studying. You've got this. See you next time.